Dr. Nangia, while we are getting the environmentalists to give us potential solutions, should there be now a massive public health awareness campaign as well? Because people need to know also the dangers of what's happening. Because one of the questions I'm posing is, what will it take for the environment to become a political issue? In a country like India, it's only at the end of the day, if there are votes to be had or lost on whether you care for the environment or don't care. Do you believe that's possible? A widespread public health awareness campaign of what poor air can do to our lives?
Yeah, I think absolutely. I fully agree with you. Now is the time when we have to have a mass movement that has to actually be in the form of public awareness about how air pollution is actually harming our lungs. Not only our lungs, but our entire health and reducing our lifespans as well. While we have been aware about it, but I think somewhere in the back of our minds, we tend to slip it very often. There are people who still come to us in the OPD saying, Doc, why should I quit smoking? As it is, we are breathing such bad air outside. So even if I continue smoking, how does it harm us? What they don't realize is that with every PM 2.5 particle size in the environment around 25 mics is equivalent to one cigarette in a day. So if the PM 2.5 concentration is around 200 plus, so 8 cigarettes, there you go completely. In a day, you breathe 8 cigarettes in a day. So, that is the kind of harm that we're doing to ourselves. Of course, the awareness is rising now, especially because what used to be called a silent invisible killer is now visible to us also. So we do see people talking about it like earlier years when people would come to us during this time of the year with cough, cold, breathlessness, you would have to tell them that, it's because of the air pollution outside. Now, when they come to us saying that ever since the air quality has dropped, since then the symptoms started, or since Diwali, the symptoms have actually worsened. So the awareness is there, but I think it's a lack of will and a lack of, I think they all need to be pushed a little to convert it into a mass movement.
As I end in the last couple of minutes, I want 30 seconds to each of you. What would it take, Anumita, to make this a political issue? I know all of you have done a lot of work on the environment for a long time, long before it became even fashionable to have shows like this on it. But what will it take? What will it take, according to you, to make this a political issue? A quick answer.
It's very clear. So while we need massive campaigns, awareness campaigns regarding the problem, but at the same time, I think we need even stronger campaign to build public understanding of the solution so that they can really make the political demand. We talk about air pollution and running away from Delhi, but when it comes to solutions, we don't create that much demand for, I want my public transport infrastructure to work when the government is giving me flyover after flyover. So it's very important to deepen the understanding because the solutions are getting increasingly complex. And we don't want middle-class environmentalism only, that I can be fine with my air purifier kind of solution. I need hard decision, difficult, inconvenient decision. For that to build public support to change the politics around the solutions is going to be very critical.
Because that's the issue that I often hear. And Pawan, you can take this, and then Vimlendu very quickly, that, this is a middle class this is an upper middle class issue. That the poor have far too many issues of roti, kapda, makan, rozgar to worry about hawa. How do you respond to those who will tell you this, Pawan, that, that it doesn't make that much of a difference to the average person of this country?
Not at all, because they are the ones who are totally getting impacted, right? They don't have purifiers. They are the ones actually more exposed. So I would really say that they are actually more vulnerable to actually what is happening, what many of us are actually leaving them with the kind of quality of air. See, we need to make difficult choices. And this is where I say that solutions are going to be difficult choices, because maybe it will make certain class uncomfortable. And therefore, I think deepening that awareness with citizens and public in general would be so critical, because you're talking about regulations, about mandates, about the need to change behavior, and all this would maybe unpopular choices. But that's where I think creating not just understanding of the problem, but the solution is extremely important, because we need to make people part of the solution process, and that is where then they are able to ask, sustainable solutions, right, to get clean air. So that's how I think we'll be able to really address this.
That's from clean air to clean water as well, because remember, many of the poor in particular are the worst, suffer the worst because of the kind of water that they end up drinking. But, Vimlendu, you're in the Prime Minister's constituency of Varanasi. I saw you the other day with Rahul Gandhi in a conversation. You know, we need, this is an issue that should cut across the political divide. The idea should be that Mr. Gandhi and the Prime Minister should come together along with chief ministers from different parties and have a national policy for ensuring clean air. Do you agree with me when I say that this issue is not to be seen through a political lens?
Absolutely, Rajdeep. It should be every party's first point in their manifesto. And as you asked the last question, with regard to it affects the poor the most. You know, it's not the same air that everyone breathes in Delhi. You need to understand that the air the Prime Minister breathes, or the air Rahul Gandhi breathes, or what you breathe, and what someone in Sangam Vihar breathes, or someone who is the sabzi seller on the street is breathing, is completely different. So one is that there's different air quality for different strata of people, and then there's also different access to healthcare for different strata of people. Because if Dr. Saab is right that it affects your lungs, if you have stunted lung growth, and you know, if you're asthmatic and you have arthritis and this, that, and the other, then it means that it affects someone who's actually standing 8 hours at the traffic signal much more than with multiple air tenders going around in Delhi government and central government of air purifiers. And our Chief Justice, I think it's very, very important for us to also, as I know that you had a fantastic interview with the previous CJI, but imagine for several hearings, he's realized that it wasn't important. Someone like a Chief Justice of India doesn't even know what AQI is. The current Chief Justice of India is saying that let's do work from home. How many people can actually do work from home, in the sense argue from home or do this virtual courtroom? Can a rickshawala or a DTC driver or a traffic cop or many people do work from home? So, when we look for solutions, we again look for solutions from a place of power and a different kind of equity and different kind of privilege.
I take your point. I hope that the current Chief Justice and the former Chief Justice are listening to you. We need real solutions, workable solutions, tangible solutions with a clear plan of action. For God's sake, let's create at least a 5-year plan so that we don't have to do these debates every year for an air emergency. We need a clear, transparent plan prepared